Time now for this week's Health Matters. Paul Critz along with physician assistant Lynn Szabo. It's a very special Health Matters this week. Very out of the ordinary. I guess people out of the area will be listening to this at some point, although it'll be about a week before we can even get this to them because of our internet access, which is being paused. But we are in Del Norte County. Del Norte County currently has a number of fires going in the eastern portion of the county that threaten the lines bringing electricity to us. And so a couple of days ago, our local power company de-energized those lines, and basically countywide we are without power. With the, notable exception of like KFUG, where we had our backup generator installed about 6 weeks ago. But we are existing without power in sort of a state of emergency and a weird state of limbo, too. It's a very, very strange sort of thing going on. And really, last night there was a community meeting, and we broadcast it. And the people asking this one woman was just dogging this question about, can you give us even a ballpark how long the power will be out?
Yeah, and they're not saying anything.
They can't. It's an unanswerable question. It depends on the behavior of a forest fire. So nobody's going to step up and put their behind on the line liability-wise and try to give somebody a number like that. Right. So we are without power. Electricity for the foreseeable future. And what I have heard unofficially, back channel sort of hearsay, which is what we have to go on in situations like this a lot, is that the hospital was told, and maybe you can clear this up, I don't know if you have access to this information, but the hospital was told to prepare for a week without power. I don't know. Okay. I don't know. Could be more, could be. My hope is that this afternoon the power comes back on, but probably not. So as well as just community-wide, all the sorts of tensions and stresses a situation like this places on a community. What about healthcare? How is our local healthcare system facing this, and how's it doing in the face of this?
Surprisingly, the state of the healthcare union is strong.
Really good.
And I was impressed. I was in clinic in Klamath on Friday, which, poor Klamath, everybody tells them last. But also in Crescent City at Del Norte Community Health Center for a walk-in clinic yesterday. Mm-hmm. And I thought that things were going really well. So here's what's working from my point of view. So I think I interfaced with the hospital ER a couple of times, and they are working, although there's kind of upcoming news about them. I was at both community clinics were open and running yesterday, and they were working. Everybody's on generators, and they seem to be okay. Outlying clinics like Klamath and Smith River were not open because it was a weekend, but they do have generator capacity, and they're used to the power going out, so they're fine. They're rolling with it.
Right.
Pharmacies were open, as is the usual ones on Saturday, so Safeway and CVS, and I imagine they were on generator power and they were functioning well. Although I was doing backup with paper for just about everybody that had a super important prescription that I didn't want messed up. And that seemed to really work well, so I might keep doing that. But the supporting staff, this is kind of another thing that I didn't realize till I got in clinic yesterday at Del Norte Community, is a lot of them are on wells, and so they don't have water.
Oh, wow.
And so they can't flush, they can't take showers, and, the grody factor is kind of rising.
I think everybody's actually, Lisa, my wife, is so intelligent. There were we both, like, as soon as we got the word that, like, the groundwork was laid for a couple of days. They were telling us this was going to happen. And then when it started looking like on Friday afternoon this was really going to happen, two things. I said, let's brew as much coffee as we can. And she said, let's take showers. But both of those stresses could have gotten out of hand. But we're pushing the edge of the grody factor here.
So mostly, and then Del Norte Community, I think possibly the Smith River United Indian Health both have showers.
Okay,
so they can direct their staff to them, and there's warm water and stuff like that. So for the most part, business is as usual, but there was one moment, dun, 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 Kind of like the moment in Star Trek when they decide to self-destruct the Enterprise. Anyway, where everybody was looking at each other, and the generator was down to 8% capacity, and was falling fast. And it was noon yesterday.
You mean it was running out of fuel?
It was running out of fuel, and a nurse came in to tell us, and we were all busily seeing patients, and we had also notified all the pharmacies in the area and the ER and everybody else that we were open for business. Anybody could come in, and I know you played it on the air, and thank you very much.
Oh, I know. Yeah, you notified us as well.
Right. So at noon it looked like, like click, tick, 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 like it was gonna like collapse, and right then the fuel guy came.
That's it.
Like right then. So I seldom see things like that in Del Norte, but that was, thank you, whoever figured that one out.
Oh,
was
my gosh.
right on the button.
You know what it probably is they have, well, I don't know if that would work. I was going to say they're probably hooked up digitally to monitor stuff, but without the internet, they wouldn't even have access to, oh my gosh.
Right. And you remember all of healthcare right now is based on
all of life
electronics.
is, yeah.
So that was like a very tense moment. We stayed open till about 2:00, which is our usual. For anybody out there listening, by the way, is the homeless clinic behind the Superette is a go for today too.
Okay.
So you're going to see the bus drive by down the road behind me, and
hours for that then too?
Hours for that is usually noon to 5.
Okay.
But sometimes if there's no interest, they'll just pack it up early. Okay. So that's happening.
So now you did get us word that Open Door was going to be open from 8 until 2 yesterday to deal with specifically non-emergency aspects.
Right,
of
and
care.
I specifically am willing to take care of stuff that's not really ER worthy. And it might even be somebody from, like, for example, Stellant. Stellant wasn't open. UHS was open, or Sutter Community Clinic, or if somebody was an evacuee and gets care out of the area but had to grab and go and forgot their antihypertensives and is worried that their blood pressure's off the charts, somebody like that can come in and get from a 1 to 3 month refill of medication until their lives settle down.
Oh, wow.
With the exception of narcotics,
right.
benzos, or anything with street value. So just know I'll be there again next Saturday, and I'll be there from 8 to 2. I won't send anybody away if, their doctor is somebody in Oregon or something like that.
Okay.
So that's a possibility. That actually was widely used when we did it at Redwood Urgent Care at the Paradise Fire.
Right.
So a lot of refugees landed on the coast because the weather was better and they had family here and support.
How busy were you yesterday? Did you see a lot of folks coming in looking for something?
We saw a total of 8 people, which is really, not very many, but it spoke to me that the community was stable. And out of those 8, I did see 3 people that utilized the refill thing.
Good. Oh, good.
Yeah.
That's good.
So that was good. Super good. So another thing that's going to happen, even though the ER is really functional right now, this is kind of breaking news. ERs are staffed by a business of ER physicians and usually PAs, but sometimes NPs, who kind of get contracts with the hospital. So they're not employees of the hospital, and this has come up here because oftentimes they don't bill insurance, and there's a fee for their services that's unintended, and maybe insurance won't cover it. Oh, wow. But an aside is there's a shift in that practice right now going on at the ER, and I think it starts this Monday from what the docs that I know are telling me. It's a little weird. I don't think that anybody outside the biz would notice a difference, because what they do is they hire all the same people. So it's just another franchise moving in, probably because the hospital got a better contract with them under terms that were better.
Okay.
There was, for a long time, a really stable hospital ER doc relationship, and then lately now it seems like every year there's a flip over, and it's happening this week.
Wow. Okay.
Which
okay.
I think is going to be okay, because usually they try and keep the same physicians, but then they also have a supply of travelers from out of the area. Now, some of the PAs that work in the ER here live in Medford, and that's problematic.
Yep.
One of the doctors lives in Ashland,
Wow.
one of the main ones.
Oh, you can get down from Ashland, though. Oh, no, Ashland. I was making it Eugene in my head. No, wrong college.
No.
So, Ashland. Yeah, that would suck, too.
Ashland's kind of a deal.
Yeah.
And but one of the main ones right now is actually a Humboldt County physician.
Mm-hmm.
So I think that they've signed contracts, or they're at least negotiating contracts with this new ER franchise.
Mm-hmm.
I know that, and I know this is happening because they reached out to me because I've worked in the ER before here, but not anymore. It's not my gig anymore. But I think the general population is not going to notice a difference.
Mm-hmm.
If anything, they might have better staffing because they're drawing from a different pool of travelers.
So let me ask, why do you bring this up then?
Because I think it could also be a mess.
It could be a mess. What a week to take over a situation, right?
Right.
Wow.
So what I think is going to happen is that nobody will notice the difference because the usual people who take care of us will be dedicated to not changing stuff too much this week.
Right.
And I think they'll sign on the dotted line. It'll probably be lucrative, but they'll sign on the dotted line, and I think that average Joe patient in the ER will not notice a difference.
Okay.
They might notice a difference if their care is transferred out, though, because, they can't go by ground anymore. So I think the air resources will be, but that's a different issue.
Yeah.
So I think it'll be okay. But it's like, really, this week?
Yeah, of all weeks to do. What a wow. That's
So,
and I've thought about, now, of all the things that I haven't thought about with this emergency that's happening, are the I mean, I've encountered in the ER doctors not from the area who were driving in, and now half the area or half the ways into the county are gone, and that would be what a hardship that's got to be.
but we still have a lot of doctors who live in the area or nearby, from Humboldt. So I think we're going to be blessed with the same old people who are always showing up when Delner needs it. So be nice to them.
Oh, God, right.
Yeah. So one thing I think to consider as far as the community clinics, I think they should add a lot more acute care visits to their schedules. And I personally think anybody who calls up and needs an appointment ought to get an appointment in a timely manner, but they have all kinds of rules about how appointments are scheduled. I think maybe somebody could put off their, just chronic stable visit kind of, and maybe focusing more on people who are displaced or have acute injuries, or just to keep people out of the ER for the stuff that the community clinics can take care of. So I'm hoping, I know my schedule is actually almost full this week, which is, I think, kind of unusual for me. But they cap me at 18 people. I'm going to beg them for more.
Really?
Yeah. Because, we need it. We need it.
Yeah.
Or at least we need the potential for it. Okay. The other thing is, I'd really like the community clinics to consider opening up their waiting rooms as, for people coming in to charge their phones and stuff. I think that's a little thing that could be super helpful.
If you've got the power, right, and you're going to be running them anyway.
Right. I got a feeling there's resistance or a reason why that kind of happened. But I think they should. I think it would be good PR and helpful. So what's shaky in the community right now? I suspect, but I don't know, that independent private practices like Blundell or the North Pacific Dermatology might not have generators. Generators are expensive, and those practices don't make huge amounts of money usually, and oftentimes in the past have declined to buy generators, although maybe they're seeing the need more and more, so maybe that's changed. But I think that those small independent practices are going to have a problem. I don't think it would be too much for derm because there's not very many derm emergencies, but Blundell takes care of a lot of complex people, and I hope he can find a way to keep his office open if he hasn't already.
Wow. Yeah.
So that's a thought. And those were the only two offices up here that it might affect dental offices somewhat, but I don't think the dentists are really that affected by it. I think they can do okay.
Never having an opportunity to speak with a dentist, I have no idea how this is influencing them.
Yeah, I've heard these people exist, but here's where the problem's going to be if they do close down and somebody's had like what should have been an acute appointment and they've been waiting for 6 months and they're going to be told kind of summarily to reschedule, and that means another 6-month wait.
Yeah, exactly.
That's going to send people to the ER, and right now that's unnecessary pressure in that direction. So I hope they find a workaround. Okay. So the other problem that's super shaky is I've been getting texts, like all of us actually, about, the state of affairs. And I don't know if other people have Spanish as part of that, like the message in English, the message in Spanish.
Yeah, the Pack Power ones especially, they come two-part.
They are, I don't know if they're relying on Google Translate or what insanity, but it's unintelligible.
Wow.
You can't. I couldn't make heads nor tails of it. My Spanish isn't that bad. So there are no providers that I know of in the community that speak Spanish. But if there are, it's time to speak to the Hispanic community. So I saw 3 people yesterday who were Spanish speaking only, and they all asked me what was going on with the power.
Oh my God.
So they know something's up, and they have no idea what it is.
Wow.
And so I explained about the transmission lines and the 2 fires, and this could be a long time, and you should, plan accordingly, and they were shocked. Wow. So yesterday was day number 2 into it.
Yeah, we're 3 into it today.
It's interesting.
Right? Yeah.
It went off at 5:03 on Friday. I'm just saying, but I found that that's when the power went off.
Yeah, and so what are you saying?
Why does capitalism?
Oh yeah, we got to get the work.
I think there's a capitalism thing there. Anyway, but if anybody is bilingual in the community, and I imagine this extends a little bit to the Hmong community, but the Spanish-speaking community does have a clue from what I was able to ascertain in the small sample size I had yesterday. So for the bilingual folks who understand what's going on, make a couple calls to leaders in the community and get the word out. Well, they are used to going by the jungle drums, so to speak. And I think once a couple of influential people know what's going on and can be good information sources, they'll take care of it from there.
And I know this doesn't have the same reach into the community as those influential individuals would, but this is obviously a way that the Del Norte Office of Emergency Services is dropping the ball as far as getting to these other. And I know everybody's in over their head right now. I'm not trying to cast aspersions on DNOES.
No, this is a how we do it better next time.
Right, exactly.
Yeah, this is clearly a how we do it better. And then, of course, the Hmong community, there needs to be addressed too, and that didn't. I'm not really involved in the community, so I don't know how it works there. But I have the sense that the young people are really good about passing along information to the elders. Plus, there's some English-speaking women that have married into the Hmong community who are quite strong leadership.
Good.
So that's good.
But yeah, we shouldn't have to rely on word of mouth like this in a situation like this. There should be actual information going firsthand into these communities from the folks who have that information. Wow.
Yeah, one thing I would say right now is that if somebody has a non-emergent need and feels like they need medical care today because they got poison oak while they were looking for their dog, trying to get him out of the fire, then, the homeless clinic will not turn you away. Alexis, the nurse there, is the decision maker, and she's a no rules kind of girl. So, and then they have a really wonderful family practice physician there. I only know him as Andrew, so I can't give his last name, but I am a big fan of his work.
Are you working there today?
No, but I might drive by and see if they need any help.
Yeah.
But so I'm like a lot of people going into Brookings for supplies.
Yeah, so is there power in Brookings? Everything's fine in Brookings,
yes,
right? Yeah.
I have vet appointments for my dogs in mid-afternoon in Brookings, and I was told by Town and Country that the Brookings is up and running fine, and then went down to Humboldt County and observe that Humboldt's like, what? There's a problem in Del Norte?
Yeah.
So if you need ice and you've got enough gas or you got a reason to drive south or north, then consider leaving the town.
I've been watching, we'll listen into the bicoastal, the commercial stations here, because we've been tying in and broadcasting updates and things that they've been giving. And we usually listen in until they start talking about stupid commercial radio stuff, and so we jump off. But one thing that is, while I'm sitting monitoring, because they all begin sort of roughly after all the commercials are done at the top of the hour, and I've been listening to their ABC newscasts, and everything they're talking about, the yellow knife in Canada, I'm hey, what about us, man?
Right.
We're like, you have to evacuate your little Canadian seaside town, whatever. I'm like, up yours. I got really
right now, LA has a hurricane over.
Right.
Oh my goodness!
Yeah.
It looks like it's going to blow by 1 a.m. this morning.
Oh
so
no, you're
going to
get rain.
And they'll be back to 70 degrees. But and I'm sorry if people are, I'm sure there's homeless populations who are at great risk and stuff.
Yeah.
But the same thing.
But once again, Del Norte, we're up here on our own.
Right.
Left on our own.
Right.
And so that's what it gets. I get worked up about these things.
Right.
And we seem to be doing it pretty well, I think. I mean, if you had to give the healthcare system here in Del Norte so far, 3 days into this, a letter grade,
I think we're doing good. We're Del Norton this to the VMAX,
there you
as
go.
we say in science.
There you go.
So VMAX is the maximal velocity.
Okay, I want to start using that.
Maximal ability.
This is the most you can get.
The best.
VMAX.
110%.
Because I know the term Del Norton it.
Yeah.
So I'll start.
I think things are going really well. It'd be nice if they could do a couple of little things, and I know they're thinking ahead.
Oh yeah.
But administrators don't often show up in clinic on weekends, and I saw a presence. So
good.
I was super happy to see that.
I think also there does seem to be kind of a sense of like, all right, we see what's not happening. Let's learn for next time, because I think we all understand there's going to be several next times.
I'm this morning in a grimmer moment. I was wondering if this is the end of the world. Is this how it really happens, by catastrophe, and we're just worn down and don't have time to recoup? And I don't. It's Susie Sunshine here.
Well,
but,
no, I just. It's also. I'm sorry. Go ahead and finish. I don't mean to cut you off.
If that's the case, you can be 100. You can be at VMAX, and it's still ultimately not going to help. Mm-hmm. But I'm impressed with the medical community. This reminds me of when things like the tsunami happened, or the Easter Sunday carnival disaster happened, and the medical community is stepping up to the plate. Mm-hmm. Super happy to see that.
Good.
Despite the behind-the-scenes complexities.
Yeah.
So, could we do this more often? Maybe that would be good.
Or maybe it's like to take the sorts of focus that we have in situations like this and just apply it to the situations that we don't see as being
right, to our slow roll disasters.
Right. The slow roll disasters, like the lack of access and poor people not being able to get the health care they need. Let's treat that like an emergency, just like this is, and put our shoulder to that wheel.
I think there's a need to think out of the box. So what I saw yesterday at Del Norte Community Health Center and also at UHS was thinking out of the box.
Yeah.
I was super happy to see that, and it was responsive to the people.
That's great. That's great. I don't know what to. So let's make a list of things so far that should be changed. Some sort of outreach to non-English speaking communities in Del Norte.
Yeah, that's coherent. Yeah,
that is. Yeah,
I
that
think
is
they
coherent.
tried. It's just.
And maybe this is something that, and obviously I think this is something that should sit with the Office of Emergency Services. This should be a county agency. You can't leave it, as we've seen with PAC Power, to try to come up with a workable translation of their text, and that's difficult. They also texted that there was a shelter at the high school. That went out just en masse to all the customers too, and so they had to go back and backtrack at this community meeting list. There isn't. You can go there. You can get water. You can charge your stuff. They have charging stations there.
Charging
at the high school, important. In the parking lot at the high school. But it's not a shelter. There is a shelter. It's set up in the main building at the fairgrounds, and it's being run by Mary Dorman and the Red Cross. And they also have DART on hand for it's the disaster animal rescue team. So if you've got animals that had to evacuate with you too, and need special sorts of ways to take care of them.
I got an idea. Let's call upon Open Door to set up their portable showers.
Oh,
they have them, I think, every Tuesday for the homeless population. But
I wonder what their capabilities are there at the fairgrounds.
I'll text somebody and ask an annoying question.
Yeah, that's a good idea. And I have no idea numbers-wise how many people are utilizing it yet, because right now it's basically the smaller communities to the east of Gasky that have had to evacuate. But there are some people there, people and animals who are having to.
But do you have warm water? I don't have warm water.
I still have a little bit of warm water.
Okay.
I don't know why. It's because I turned my my water heater to like 1,000,000 degrees, so it's taken it like 48 hours to come back down to like. But it's just about back down to there. So yeah, that's an issue. But yeah, the showers would be a nice thing. There was at the meeting, I don't know if you got a chance to listen to it at all. We'll be airing it again today at some point. I've got to find a hole for it.
Yeah, I told him I would only listen on KFUG.
Nah, thank you.
There you go.
But a lot of people there. First off, the questions asked by the community people across the board, like really like practical questions, no stupid political. It was like, I got a CPAP machine. What the hell do I do?
What do I do about insulin? I saw that on Facebook.
Yeah.
That's another. I think the community clinic could step up and help both with insulin storage, because it has to be refrigerated in a certain temperature range. So.
If you need oxygen, if you need your whatever things recharged with your oxygen systems and stuff, you can go to the airport. They will take care of you out at the airport. They've got equipment out there to do that. I imagine Calor or something out there to set something up. So, we're Del Norton this. And it was really... The one thing, there was one guy who politically I know and I'm not down with, but he stood up and he asked a question. And his question was, hey, is there something? And this was like, again, this was also sort of a bent with the questions I saw. A lot of the questions were like, okay, here we are. We're in the midst. Let's plan for next time. And this question was, all right, so next time, hey, man, it wasn't as stupid as I'm going to make it sound, which is basically, can't we just, come up with an agreement with Brookings and run a drop cord from Curry County down to here when this happens again? And it was so disheartening, the Pacific Power person who was there, and I don't know if it must have just been a PIO, right? But basically their response was, oh, it's complicated. It's more complicated than that. And I felt so put off.
So the next question is,
Yeah, does that mean you don't understand it?
Yeah.
Then because
does that mean there's a monetary block?
Right.
Or a technological block?
There you go. What's the complication here exactly? Yeah, so that was a very off-putting sort of response, but by and large, and by and large, the responses from county folks were like, we're there. This PIO, that was such a bad optics sort of thing for Pacific Power to handle somebody who had a legitimate thing. 30 miles from here, everybody's living their lives absolutely fine. How come we can't do something about that?
The receptionist at the vet stop, oh, you guys don't have power?
They don't even know about us, and they're right next door. And because we all went quiet. We dropped off the grid, and like nobody noticed.
Maybe they're just relieved.
Yeah, well, you just watch it.
Yeah, we're roaring back, you guys.
Because first off, we're going to come up there and get into your stuff.
Take all your ice.
Take all your ice and
all your
cash
water.
out of your ATMs. Oh my God, it is such a strange time. But yeah, I think we're doing okay.
I think we're doing really great. I think so. The state of the medical community is strong here.
Good.
I think there will be some hiccups, but I think it'll be just fine. It'll be fine.
In a lot of ways, this emergency like this is just taking the problems that face Del Norte chronically and just turning them up to 10, right? Being cut off, lack of access, all the things that we have to...
Capitalism sucks, yeah.
All those things we have to face every day.
Language barrier. Yeah.
Well, good.
So.
Well, good. I go good. This is let's bang on the machine. Let's bang on it and see what breaks, and then we can hopefully come back in and fix it for next time.
Exactly.
All right. Well, so are you doing anything special? Just a couple of minutes left. Are you doing anything special to deal? What is your electricity-less Sunday going to be like?
Garbage disposal.
What are you doing?
I had a bonehead moment, and I'm like, hey, this is an opportunity to clean the refrigerator. So I'm just pouring stuff in the garbage disposal, and then I'm like, oh yeah.
Oh no.
Yeah. Oh, no. So that's my particular challenge today. And maybe that's what I'm going to do better the next time. But I'm super lucky in that UIHS gave us, they had our employee appreciation gig, I think on the 9th of August down at Padua, and they give us gifts every year, little. This wasn't a trinket, oftentimes it's a jacket or, something like that. And they're always well thought out. This was a little portable battery that you can charge your phone off of.
Ooh.
And I got it in my possession one day before the power went out.
Oh, no. Were you able to charge it up and use it? And do
So, they gave them out not just to me, but they gave them out to all staff. So part of this, it's the support staff is not only trying to provide good medical care for you, but they're trying to take care of themselves and their families. So yay, UHS.
Right on.
Yeah.
Well, we all live here.
Yeah.
All right, Lynn. Well, thank you. I guess we'll just have to wait and see what next week brings.
Yeah.
Maybe next week the topic can be how we were wrong and it all fell apart this last week.
No, it's not. I have more hope than that.
We're all wearing animal skins and. All right, no, it won't be that dire. But whatever it is, it'll be a PA Lynn Szabo, physician assistant Lynn Szabo, and Health Matters next week. Lynn, thank you much.
You're welcome.